We're counting down the 10 most critical airline health rule changes every traveler over 50 needs to know for 2026. From surprising airport upgrades and new medication allowances to essential documentation and in-flight protections, these updates will redefine how mature travelers prepare for and experience their next flight. Some rules aim to make your journey smoother, while others introduce new steps that may catch even seasoned flyers off guard. Which new regulation will have the biggest impact on your safety and peace of mind? Let's begin the countdown with number 10. In the 10th place, a major relief is coming for travelers who rely on liquid medications. Starting in 2026, the TSA and European authorities will allow up to 2 liters of prescription liquids in your carry-on, provided everything is clearly labeled and supported by a doctor's note or digital medical profile. This is a dramatic increase from the old 100 milliliter limit that caused so much stress for seniors carrying insulin, saline, or other vital treatments. Agents may still swab your containers for security, but as long as your medications are in original packaging and you have the right paperwork, you can bring what you need without fear of confiscation. The expanded list of qualifying liquids includes not just insulin and saline, but also eye drops and certain nutritional supplements prescribed by your physician. While this rule change immediately eases airport anxiety for many mature travelers, it's important to be ready for the declaration process at security. Having everything labeled and documented keeps your journey smooth from the very first checkpoint. Number 9, prescription documentation and digital medical profiles are taking center stage for travelers over 50. Airlines and airport security will now require that all medications be packed in their original pharmacy containers, with labels clearly showing the traveler's name and prescription details. But that's only the start. Every medication must be backed up by a physician's letter or an approved digital medical profile. The letter needs to list the patient's full name, diagnosis, each medication, and its dosage, plus the prescribing doctor's contact information. For those who prefer technology, QR-verified digital health profiles from DOT or EASA-approved apps are accepted at security checkpoints, as long as they display the same details as a physical note. These requirements are meant to prevent medication seizures or confusion at borders, especially with controlled or restricted drugs. Skipping this paperwork can mean delays, confiscation, or even denied boarding. With these rules, the focus shifts from just volume limits to making sure every pill and vial is properly documented before you pack your carry-on. 8th place, smart packing protocols for medications are becoming a must for travelers over 50. The new guidelines recommend using a clear zippered pouch for all prescription and over-the-counter medications, making it easy for security agents to inspect contents without handling every bottle. Time-sensitive medications like insulin or heart pills should be packed at the very top of your carry-on, never in checked luggage, to avoid delays if your bag is held up. Each item needs to be labeled with your name, dosage, and timing instructions, and experts now suggest adding a 1-page medical summary right in the pouch, listing your diagnoses, allergies, and emergency contacts. This simple step can be a lifesaver if you need help in a hurry. Travel clinics also advise keeping backup prescriptions and a small supply of critical meds in a separate pouch, just in case. Packing this way not only speeds up airport screening, but ensures you have everything you need within reach throughout your journey. Number 7. Airport medical assistance zones are becoming a lifeline for travelers over 50. At major US and European hubs, these staffed zones now provide on-the-spot help with everything from medication refrigeration to setting up medical devices before your flight. If you rely on insulin, oxygen, or a CPAP, these zones offer secure storage and a quiet place to get your equipment ready, rather than scrambling at the gate. Trained staff, often multilingual, are on hand to answer questions, coordinate with airlines for in-flight accommodations, and even connect you to a medical hotline if you need a doctor's input before boarding. Fast-track security lanes are linked to these zones for seniors traveling with health equipment, so you can bypass standard lines and get assistance right where it's needed. While the rollout is required at all major airports by the end of 2026, some locations are still ramping up, with staffing and funding disputes causing uneven service early in the year. For now, it's smart to check your departure airport's website or call ahead to confirm zone hours and available services, especially if you're traveling with specialized medical needs. These zones mark a shift from expecting travelers to manage everything themselves to airports providing real, hands-on support, making the journey safer and less stressful for mature passengers. Number 6. The Companion Gate Pass is changing how older travelers navigate airports. Starting in 2026, passengers aged 50 and above can request a gate pass for one companion, usually a friend or family member, to accompany them past security all the way to the boarding gate. This means you are no longer left to manage the maze of terminals, security checks, and last-minute gate changes on your own. The Department of Transportation now requires airlines to make this option available, but you will need to request it either during booking or at least 72 hours before your flight. The process is straightforward. Submit your companion's full name and government-issued ID, and the airline will issue the pass for use on departure day. Some foreign airports may have different rules, so it is smart to double-check if your journey includes international connections. The Gate Pass is separate from wheelchair or medical escort services. It is designed for travelers who do not need physical assistance but want emotional support and an extra set of eyes and hands. This small change is already reducing stress and confusion for mature travelers, especially those managing complex medication routines or simply feeling overwhelmed by crowded terminals. With a companion by your side, the journey through security and to the gate becomes much more manageable and reassuring. Number 5. AI-driven pre-flight health questionnaires are about to become a standard step for mature travelers on long-haul flights. If you're 50 or older and your journey lasts more than 8 hours, you'll be asked to complete a digital health screening before you board. This new system, developed by Aerovigil and Metadata Labs, uses a secure online questionnaire to check for chronic conditions, medications, and any mobility limitations that could affect your flight. The goal is to spot possible medical issues early, so airlines can prepare for in-flight needs or, if necessary, recommend a different travel plan. High-risk cases, like recent hospitalizations or unstable heart conditions, are flagged for follow-up by airline medical staff, but your answers are stored for no more than 30 days before being permanently deleted. For those who prefer not to use digital tools, a paper version is available at check-in. The European Aviation Safety Agency has made it clear that your consent is required before sharing any sensitive health information, and you can opt out of non-essential questions. This extra layer of screening doesn't replace help from airport staff or your doctor, but it does mean fewer surprises once you're in the air. It's a shift toward using technology to make flying safer and more predictable for older adults, while still giving you control over your personal health data. Number 4. Airlines are removing the last hurdles for travelers who depend on medical devices like CPAP machines, portable oxygen, or wheelchairs. Starting in 2026, every major carrier must transport these devices free of charge. No hidden fees, no special paperwork, and no last-minute surprises at the check-in counter. At the airport, medical devices are now tagged with a priority flag and board the aircraft before standard luggage, so your equipment is always stored near your seat, never lost in the cargo hold. For travelers over 50, this means no more wrestling with overhead bins or worrying about damage during transfer. If you use a device that requires a backup battery or charger, you can declare it at the check-in desk or at the medical assistance point, where staff will ensure safe handling and quick access if needed mid-flight. Airlines are also required to verify device readiness before boarding, but some travelers have reported brief delays if paperwork is incomplete, so double-check your device registration and bring any supporting documents. The new rules guarantee that essential health equipment travels with you, not against you, making it easier to manage chronic conditions and respond quickly to emergencies in the air. This level of service marks a major step forward in protecting the rights and dignity of mature travelers. setting a new baseline for comfort and safety on every journey. Coming to the top 3, airlines are overhauling their onboard emergency medication kits, an update that means real peace of mind for travelers over 50. Starting in 2026, every long-haul flight must carry a stock supply of life-saving medications, including nitroglycerin tablets for chest pain, glucose gel for diabetic episodes, and epinephrine auto-injectors for severe allergic reactions. These are not just token supplies. Airlines are required to meet detailed FAA and EASA kit lists, which now mirror what you would find in a well-equipped emergency room. Crew members are no longer just trained once during initial onboarding. They will complete quarterly drills focused specifically on responding to cardiac events, diabetic crises, and anaphylaxis. According to cabin crew reports, most in-flight medical emergencies involving mature travelers happen within a 6-minute window, where fast access to the right medication is critical. The new rules mean flight attendants are prepared to stabilize a passenger until the plane can land, or a doctor on board can take over. For many older adults, this change addresses the biggest worry about flying. What happens if there is a serious health crisis at 35,000 feet? With these expanded kits and better training, the gap between a mid-air emergency and real help is finally closing. It is a direct response to years of testimony from both health experts and travelers. And while it does not prevent every crisis, it gives mature passengers a much better chance of a safe outcome if the unexpected happens. Number 2, airlines are making prevention the new standard for in-flight comfort and health, especially for travelers over 50. Starting in 2026, every long-haul flight will supply hydration kits and compression socks to mature passengers as part of a proactive wellness program. Cabin crews are now trained to distribute bottled water, electrolyte packets, and single-use socks within the first hour of boarding, with extra supplies available on request. For those concerned about deep vein thrombosis or leg swelling, these compression socks aren't just a courtesy. They're backed by medical research showing a real reduction in clot risk on flights over 4 hours. Airlines have also codified the right to request extra legroom or aisle seats for mobility and circulation concerns. You can now select these options at booking or during check-in, simply by stating a need for senior seating assistance. On flights lasting more than 3 hours, new rules require that guided stretching or movement videos play every 2 hours on the in-flight entertainment system. These short routines are designed with input from physical therapists and focus on gentle movements that you can do right in your seat. The goal is to keep blood flowing, reduce stiffness, and help you arrive feeling less fatigued. For travelers who want to be even more proactive, some carriers now offer a pre-flight wellness briefing via their app with personalized tips based on your answers to the new health questionnaire. These comfort measures represent a shift from treating health issues only after they arise to preventing them before they start, giving mature travelers more control and peace of mind on every journey. And finally, in first place, a sweeping new requirement is reshaping the travel landscape for anyone over 50. Baseline travel insurance must now include emergency coverage for pre-existing conditions. This means that every airline ticket purchased after January 1, 2026 comes with an insurance policy that covers sudden flare-ups of chronic illnesses. Think diabetes, heart disease, or asthma while you're abroad. The days of worrying about being denied care or stuck with a massive bill if your long-managed condition takes a turn are coming to an end. Insurers like AARP, Allianz, and MedAllied have rolled out senior-ready plans, clearly marked and easy to compare, so you know exactly what's included before your trip. Under the new rules, all policies must pay for emergency stabilization and hospital care if a chronic issue becomes urgent, even if you've had the diagnosis for years. Tiered pricing is allowed, so premiums may be higher for travelers with more complex health histories. But basic protection is mandatory. No more hidden exclusions for the very conditions most likely to cause trouble. There's one catch. You'll need to confirm your coverage at least 3 days before departure, either through your airline's booking portal or directly with the insurer, to make sure your specific medications and diagnoses are listed on the policy. If you're already insured through a private plan or Medicare supplement, you can opt out, but you'll have to show proof of comparable coverage. This requirement closes the last major gap in the safety net for mature travelers, following years of advocacy and hard data showing that medical emergencies abroad are both more common and more costly for this age group. With this safeguard in place, the risk of being stranded without help or facing bankruptcy over a medical crisis is dramatically reduced. For the first time, older adults can plan international trips, knowing that if the unexpected happens, they won't be left to navigate foreign hospitals or insurance claims alone. It's a change that brings real peace of mind, and it crowns the 2026 health rule reforms as the most consequential shift for senior travelers in decades. From the expanded 2-liter liquid medication allowance at number 10 to the sweeping mandate for travel insurance covering pre-existing conditions at number 1, these 10 airline health rule changes paint a clear picture. 2026 is a transformative year for travelers aged 50 and above. The most surprising entries, like the introduction of staffed medical assistance zones in airports and free priority handling for vital medical devices, signal a shift from isolated fixes to a comprehensive layered safety net. Across the list, one pattern stands out. Each rule builds on the previous, moving from personal responsibility, such as documentation and smart packing, to systemic protections like airport infrastructure and mandatory insurance. What qualified each item was its direct impact on health, safety, and peace of mind for older adults in transit. As the number of mature travelers rises and in-flight health incidents gain attention, these rules reveal a new era where airlines and regulators prioritize prevention, rapid response, and financial security. Together, they ensure that for seniors, air travel in 2026 is safer, more accommodating, and more predictable than ever before.